slide down there. Okay, so today we're talking about the benefits of being adjusted while pregnant. The main benefit is keeping the hips in line and the pelvis in line. That will help to prevent sciatic pain, but also helps with your basic movement. And then once the birthing process does begin, the better alignment that you're in, the smoother pregnancy will go. And I'd say almost every patient we have that is pregnant that goes through the birthing process has a much smoother process when we're adjusting versus patients that don't. So perfect. That's always a big one. And we're off just a little bit on that left side so you can see how the left leg's pulled up. That left glute's a little high. So that's the first thing we're going to fix. Pardon me. And we always do this really gently with pregnant patients. As you'll notice, we have a pillow that allows them to lie face down all the way up through their third trimester. And then we'll use this drop piece. And we do this really lightly. And we're just moving that hip up into position. And once that's aligned, we have much better range of motion. Next, we use a tool called an impulse adjuster just to do some work on these muscles. Sometimes I like to pretend like I'm a sheriff in the Old West.
Humor's always an additive.
You have to have a little fun. Okay, so we'll be easy with these, but take a deep breath for me. And breathe all the way out. And hold that out. Good. Little bits of motion there, but we won't put a lot of pressure on those. And sometimes the pillow can work to our benefit with that, and other times it makes it a little more difficult. And then we can nudge any of these bones in the direction that we want them to go with the activator. This particular patient always has some really tight traps, so we're going to hit those muscles as well.
And what does that gun do exactly?
So when we hit the muscles, it activates the reflex receptor, so it gets the muscle to contract, and that gets it to overload and reset. So any muscle that is tight, we can get to completely loosen up using this machine, but also I can nudge any bone in the spine in any direction that we want, especially in the cervical spine. It works really well to move those bones. And we'll do just a little bit on your left side here, my friend, or right side. Especially with pregnant patients, we don't want to be too forceful, so we don't use a lot of aggressive chiropractic maneuvers with them. We like to just keep things kind of light, only move what needs to be moved, relieve muscle tension. Okay. And nice and easy, go ahead and sit up for me and face the chair over there.
The skeleton is making his
Oh yes, he's a stoic character. And look down to the ground. So this next machine is our vibration gun or massage gun. And same thing, we just hit these muscles that are tight. And by using this gun, we help to realign the myofascial plane of the muscle. So all muscles are encased in fascia. Fascia can get sticky. So this gun actually gets all of that realigned and gets it moving correctly. Also flushes out lactic acid and brings in the good circulation, as well as a little bit of actual percussion to the muscles, so helps to loosen them up and just feels overall really good. Okay, now I'll just do a little bit on the hip. Just a little bit on that left glute where that hip was off. Okay, and that's it.